All right, everyone. Welcome. Welcome to the Department of Learning Health Sciences 2021 Roland Red Hiss event and Medical Education Scholars Program Research Symposium. We're so glad you've joined us today. My name is Alexandra Vinson, and I'm an assistant professor in the Department of Learning Health Sciences and the director of the Medical Education Scholars Program. We're here to celebrate Dr. Hiss's lifetime of contributions to medical education at the University of Michigan Medical School. And what better way to do that than to share the educational projects and initiatives accomplished by this year's Medical Education Scholars Program within the Department of Learning Health Sciences. And now I'd like to invite Dr. Chuck Friedman to say a few words of welcome. Dr. Friedman is the Department Chair of Learning Health Sciences and the Josiah Macy Jr. Professor of Medical Education. Chuck, the floor is yours.
Thank you, Alexandra. I'm very, very pleased to be here and very pleased to welcome everyone to this wonderful event. I'm very much looking forward to hearing about the presentations, the excellent presentations of the projects of the MESP scholars who completed the program this year. I want to particularly welcome the members of Dr. Hiss's family. It was a pleasure meeting all of you. I believe the last time this event was held in person, and I'm very much looking forward to meeting you again when this pandemic is past us and we can all gather to celebrate the accomplishments of Red Hiss face to face. It deserves that. We need to be face to face to celebrate. But this event is a terrific occasion. It will be very educational for all of us. I'm very glad to be here and very glad that you all are here. Alexandra, back over to you.
Thank you very much, Chuck. As you know, we're here to celebrate today the past, present, and future of medical education at the University of Michigan. And one of the figures who laid the foundation for our activities today is Dr. Red Hiss. I'd like to share with you a little bit about his life, and additional details are provided in his biography, which is printed in the program. After spending his childhood in Montclair, New Jersey, Red Hiss came to the University of Michigan, where he earned his bachelor's in 1955 and his MD in 1957. He was an absolutely fantastic percussionist, and he played cymbals in the University of Michigan marching band. After briefly leaving the university for his internship and a tour in the United States Air Force, Dr. Hiss returned to the university in 1961 for his internal medicine residency. After completing his hematology fellowship, Dr. Hiss joined the faculty, where he was eventually promoted to full professor and was chair of the Department of Postgraduate Medicine and Health Professions Education, which later became the Department of Medical Education. In 2002, the University of Michigan Medical School awarded him the Lifetime Achievement in Medical Education Award. He retired from the university in 2003, having made numerous institutional and national contributions to medical education, patient education, and diabetes care. What an incredible career, and I've only touched on his professional accomplishments. What I've learned in reading about his life is that he was a patient, good-humored, and dedicated to making things better, and an avid Michigan football fan. But my understanding of him can only go so far because I was unfortunately not lucky enough to know Dr. Hiss personally. But I would like to turn the floor over to Dr. Clifford Craig, Associate Professor of Orthopedic Surgery, who will say a few words about what it was like to have Dr. Hiss as a teacher. Dr. Craig, the floor is yours.
Thank you for allowing me to participate in this special day for Dr. Hiss and to express not only my appreciation, but the appreciation of the class of 1969 for his contribution to our medical education. We first met Dr. Hiss in the spring of 1967. He was a course director for a course on clinical procedures. At that time, a simulation lab didn't exist. So for us to get experience in blood drawing, making blood smears for white cell counts and differentials, placement of nasogastric tubes, and other clinical procedures, Dr. Hiss had us practice on each other. As you might imagine, this resulted in many memorable and unforgettable experiences. Like many others, I questioned the necessity of requiring us to become competent in these procedures, thinking there would be technicians to do them. However, when I started as a surgical intern in the emergency room at Boston City Hospital 2 years later, I really appreciated the course, as I had to do all these procedures myself because the technicians all left at 5 p.m. When I returned to Michigan in 1999, I met Dr. Hiss in the hall one day and asked him if he still had medical students put nasogastric tubes down each other. He smiled and told me he had stopped several years earlier because the course was now at night and a student had collapsed, leaving him to care for the student and keep the class going. I also related my experience during surgical training and appreciation for the course content. At our 40th class reunion, I brought a nasogastric tube along and indicated that Dr. Hiss said I still needed a volunteer to pass a nasogastric tube on to pass his course. That not only brought out lots of laughter, but also an appreciation for Dr. Hiss and his course. This from students who had gone on to become Dean of the Medical School at Johns Hopkins, Chairman of Orthopedics at Yale, and Professor of Medicine at Michigan. In closing, for me, Dr. Hiss's legacy is teaching a generation of Michigan medical students not only how to do procedures, but by having them do them on each other, providing them with empathy and appreciation of the patient's perspective who must undergo these procedures.
Thank you very much, Dr. Craig. My understanding is that Dr. Hiss was a very enthusiastic person, and it's clear that some of this enthusiasm must have carried you all through the more challenging moments in your clinical skills course. Now I'd like to provide an overview of today's event. One of the major emphases of Dr. Hiss's career was on strengthening postgraduate and continuing medical education for physicians. And when the Hiss Lectureship was established in his memory, the Medical Education Scholars Program was identified as the program that should benefit from and support the Hiss Lectureship. The Medical Education Scholars Program, or MESP, is a longitudinal faculty development program focused on educational research, clinical teaching skills, and leadership. MESP was founded by Dr. Larry Gruppen in 1998 and thrived under the leadership of Dr. Patricia Mullen, first in the Department of Medical Education and now in the Department of Learning Health Sciences. As of this year, nearly 300 Michigan medicine faculty have graduated from MESP. The role of MESP is to support the ongoing development and lifelong learning of Michigan medicine faculty. By strengthening our faculty as educational leaders, scholars, and teachers, MESP supports the educational missions of the medical school and Michigan medicine. Importantly, MESP also builds community among medical educators and educational leaders within Michigan medicine. We're so happy to be able to host this MESP Research Symposium as part of the 2021 Roland Red Hiss event. The cornerstone of MESP is the Scholars Individual Project. As we move into the remainder of the event, you will have an opportunity to join the scholars as they present their progress on their individual projects. This year, we have had 8 fabulous scholars, faculty and fellows from Michigan Medicine, 7 of whom will be sharing their research projects with you today. Here's the event schedule, which is reproduced on the second page of your program. I'd like to explain how the sessions will work and how you can navigate to each presentation. In your PDF program, you will find a number of clickable buttons. These will allow you to view visual abstracts, project summaries, and even a video introduction from our scholars. There are also buttons that you can click on to join the scholars in their Zoom rooms to hear them give a live presentation of their project and participate in the discussion. Here is a graphic representation of the event structure. As you can see, 3 scholars will be presenting in session 1 and 4 scholars will be presenting in session 2. Within each session, each scholar will present their slides and answer questions 2 times, which will give you an opportunity to learn about a total of 4 projects today. For those presentations you're not able to see live, you'll be able to view their abstracts and summaries even after the event ends. Please allow for a little bit of shuffling as you move from room to room. We're all doing this virtual event for the first time together, and no one can be exactly sure how it will play out. If you happen to miss a bit of a presentation, we hope you'll be able to fill in any missing information by looking at the scholars' written materials. At the conclusion of session 2, please join me back in this webinar for brief closing remarks. If you happen to run into trouble during the event, please use the help button located at the bottom of the session 1 and session 2 pages to re-enter this webinar. Someone will be here to help you if you put a question in the Q&A pane. And with that, I hope you enjoy the research symposium. All right, everyone, welcome back. What a whirlwind. I hope you had a wonderful time learning about the exciting independent projects that are being carried out by this year's Medical Education Scholars Program cohort. Before we part, I'd like to say a few brief words of thanks to the many people who have contributed to today's event. First and foremost, I would like to thank members of the Hiss family for joining us today. We are excited to be able to celebrate Dr. Hiss's legacy with you. Thank you especially to Peg Hiss, Dr. Hiss's wife, and to Richard and Jane Hiss, whose support has formed the foundation of this lecture series. I would also like to thank John Hiss, Bob Hiss, and Dr. Hiss's colleagues for being with us and for supporting the Hiss lectureship. To the graduating MESP scholars, congratulations on a job well done, and thank you for all of your hard work. And finally, I'd like to thank a number of people who made this event the logistical success that it was. First, Deirdre Jeske, our MESP program coordinator, has not only contributed major effort to making this event a success, she is my partner in planning and carrying out the Medical Education Scholars Program. Thank you, Deirdre, for all your hard work, creativity, and collegiality. I would also like to extend a special thanks to Lauren McCarthy and Kathy Karajanis, who drew on their experience hosting large virtual events to help make today a success. Thank you, Lauren and Kathy. And I'd like to thank Emily Coulter-Thompson, our DLHS department strategist, as well as Jackie Rink and all of her colleagues in the Michigan Medicine Office of Development for their support of the Hiss lectureship and this event. And at this time, I would like to formally invite you to join us for the 2022 Hiss lecture, which will take place on June 7th, 2022. We hope to be able to be together in person, so please save the date. Thank you again for attending the Department of Learning Health Sciences 2021 Roland Red Hiss event and Medical Education Scholars Program Research Symposium. Be well, and we will see you next June.